How does radiation therapy uniquely affect seminoma? Imagine a treatment that targets cancer cells with precision because of how sensitive they are. That's exactly what makes radiation therapy so effective for seminoma, a common type of testicular cancer. Seminoma cells are highly responsive to radiation, meaning they can be destroyed effectively without harming too much of the surrounding healthy tissue. This high sensitivity allows doctors to use radiation to kill remaining cancer cells after surgery, especially in the lymph nodes located at the back of the abdomen, called retroperitoneal lymph nodes. These are common sites where seminoma can spread. Seminoma is unique among testicular cancers because of this responsiveness to radiation. After removing the affected testicle through a procedure called orchiectomy, radiation can be used to target any microscopic disease that might be hiding in nearby lymph nodes. This helps prevent the cancer from coming back. For early-stage seminoma, which is confined to the testicle, radiation was once a standard follow-up treatment. But now, because surgery alone often cures the disease and to avoid long-term side effects, many patients are managed with active surveillance or chemotherapy instead. Radiation is still considered for cases where the cancer has spread to lymph nodes or in higher stages. In stages where the cancer has spread to lymph nodes at stage IA or IIB, radiation remains a key option. It involves delivering a carefully calculated dose, usually around 30 to 36 gray, directly to the affected lymph nodes. This dose has been shown to lead to very high survival rates, often over 95% after 5 years. For more advanced stages, doctors tend to prefer chemotherapy because it can treat cancer that has spread beyond the lymph nodes more effectively. Radiation for seminoma is usually given as external beam therapy, which means high-energy X-rays are directed precisely at the affected areas. This method minimizes damage to healthy tissue and makes the treatment safer. Sessions are quick, but they requiring detailed planning to ensure the right dose reaches the target while reducing side effects. Speaking of side effects, patients might experience fatigue, skin changes at the treatment site, nausea, or diarrhea. These effects are generally temporary and tend to improve after treatment ends. Fertility can also be affected temporarily, but most men see their sperm production recover within 1 to 2 years. If fertility is a concern, discussing sperm preservation options with a healthcare provider before starting treatment is a good idea. In summary, radiation therapy uniquely affects seminoma because of how sensitive these cancer cells are to radiation. It effectively targets lymph node disease after surgery, helping to achieve excellent cure rates. The decision to use radiation depends on the stage of the cancer, balancing the benefits with potential long-term risks. As medical practices evolve, many early-stage cases now favor surveillance or chemotherapy to avoid unnecessary radiation exposure. Always consult with a healthcare professional for personalized advice, as treatment plans are tailored to each individual's situation and health needs.